everyone. Thanks for taking the time out of your busy schedules to chat and learn a little bit from us. I did a talk at HealthTO, formerly known as RehabTO, about a year ago, and the growth that this event has experienced over the past year is absolutely tremendous. So first of all, I'd like to congratulate Maggie on the success of the event. So the topic I'm going to be talking about today, and I get asked about this often, is what do we see as the future of connected health, and what does connected health really mean? So I'm just going to break this down into 4 parts. First is an intro to QOC Health, and I'm not going to do a pitch. I was warned that that's offside, but I do need to provide a little bit of background about what our company does so that my comments make sense. And then really around the 3 elements that I feel are really necessary for reaching that promise of connected health. So that is gathering data from people directly at home, then connecting the healthcare organizations with said data, and then connecting the healthcare systems to the cities that they actually belong in. So the first part of this is why do we need to actually collect data from people at home, and why does healthcare need to move into communities? And I think I'm probably preaching to the converted a little bit here, but just to say that there's been a lot of press recently about healthcare costs rising, and this is only going to continue to increase on both on a gross basis and a per capita basis, just because of the demographic trends. So within the next 10 years, a full quarter of Ontario's population is going to be senior, and that obviously is going to put a huge increased burden on the healthcare system. And getting people into clinics and hospitals every time they need help is just simply unsustainable from a financial perspective. There's obviously current frustration with current models, and this doesn't just go across, this isn't just a Canadian problem, this is a problem with healthcare systems worldwide. And I think anyone who's had any sort of prolonged interaction with the healthcare system has probably at some point brainstormed some process improvement that they could implement there. And finally, we're in a great spot because we actually have the ability now with emerging technologies to actually tackle some of these problems. So in the past, all these healthcare systems were really set up as a hub and spoke system, but there wasn't really anything we could do about it. That was the actual most efficient way that we could set up the system. And now with new technologies, there's ways that we could evolve beyond that. And part of doing that, part of those emerging tools is really around digital technology, and that's where QOC Health comes in. So really the premise that the company was founded on was that the folks that are in the best position to come up with digital health innovations, whether those are innovators, entrepreneurs, researchers, policy folks, clinicians that are on the ground, they're often in a pretty poor position to actually execute on a digital health product development. And there's a variety of reasons, I'm not going to go into them, but basically around privacy and security, interoperability, and then the ongoing challenges of technology and product management. And so what we do at QOC Health is we have a technology platform that allows us to quickly white label, scale, and commercialize digital health innovations. And here's just a sample of some of the ones we've worked on, and they're in a variety of different clinical areas, from post-surgical care to maternal health, mental health, etc. And really, the backbone of this is our Patient Connect platform. So this is really almost like a set of development tools and modules that we can use as a foundation to build these digital health and web portals on top of. So this Patient Connect platform is the one that connects all of our applications to a central data management, privacy and security management system, as well as being able to interoperate with devices, sensors, other hospital systems, etc. And so that really leads us into the first part of this, which is how do we gather health data from home? And so there's lots of different ways we can do that. And again, the availability of emerging technology is really moving this in a huge leap forward that I think everyone here in the room recognizes, but must appreciate this is fairly new. When we started QOC Health in 2010, smartphone uptake in Canada was only at about 12%. And so to think back to 5 to 6 years ago, when that was the case, is almost unimaginable now. And so there's lots of new sources of health data that we can gather from patients that was previously unavailable to the health system. To think about all the health data that's out there, it's all being collected from when you go in the clinic, and now there's obviously new sources. One are wearables, so things like Fitbits, fuel bands, etc. Different types of sensors that you've got on your body at any given time that weren't purposed specifically for medical, but obviously have some medical application. The second bucket are those traditional medical devices that have been around before the smartphones, glucose monitors, point-of-care diagnostic tools, scope sensors that you would traditionally associate with healthcare. And then finally, again, smartphone and web apps, which have really seen a huge proliferation over the last 5 to 6 years. And here's just a list of some of the companies and organizations that we're working with right now to collect data from their patients and their customers. Now that's kind of step one of the equation, is getting that data out of the home and into a database of some sort. The second part is really now connecting all those so that they don't act as silos in the system. So don't worry about that chart on the right. All that is to show that there's lots of different sources of data that we got to connect them to providers, citizens, and researchers. So on one side, companies like ourselves, QOC Health, really work on connecting those applications, devices, and organizations together. But there's lots of other organizations tackling them as well. MedChart would be one of those. TEL's GTA Connect is building infrastructure to connect the hospitals. MyChart, Health Myself, etc. So these are really solving that problem. But once we get that data, how do we then connect it and make sure it's shared with the people to make smart decisions? And finally, I think this is where it's going to be a little bit more interesting, is now that we have the healthcare system connected, not that we have it there today, but that's what we're aspiring to, how do we make sure that the healthcare system actually interacts with cities in a way that's useful and moves things forward? There's been a lot of focus over the last few years on impact investing and organizations that have a social purpose. And QOC is no different. But how do we make sure that everyone who self-proclaims as a social innovation is actually pulling the society in the right direction? And this is where I'm going to do a bit of a plug for certified B Corps. So B Lab is an organization that's based in the US that certifies organizations, whether they're non-for-profits, governments, or for-profit organizations, on common sets of social metrics. Environmental sustainability, social mission, governance, and I believe the last one is transparency and treatment of employees. And so this is to make sure that whether you're a healthcare organization or some of these other organizations across the bottom, like Etsy and BDC, that you're making sure that you're actually comparing apples to apples when people are talking about social impact and social missions. And this is really a way to make sure that people are working towards common goals. We're all trying to push in the right direction while making a sustainable organization, whether that's through the for-profit realm or for the non-for-profit realm. So just to summarize these comments, I just want to give everyone kind of a small call to action. So the first lesson is, the healthcare system as it's currently set up is not going to be sustainable just from a financial perspective. So it's important for everyone in the past who's relied on the healthcare system to tell them exactly what they do, that really the onus is on you now to start taking care of yourself. Obviously relying on the expertise within the healthcare system, but recognizing that over the next couple decades, more of that responsibility is going to be on the individual citizen. So educate yourself, make sure you make smart choices about your own health. The second thing is, and whether Canada wants to admit this or not, even though it's a public healthcare system, there are certainly private players in the healthcare system, even in Canada today. And this shouldn't be something that's feared, but something that should be looked upon as ways to supplement the healthcare system and drive the healthcare system forward. So, the fact that things have been done a certain way over the past few decades, and there hasn't been a lot of change in that model pre-2010, isn't a reason not to demand more from the healthcare system, whether that's at the political level, or whether that's through some of the new players that are in this space, or other new startups that are going to come down that can actually influence your health. So demand more of them and embrace the fact that there's going to be new types of healthcare organizations out there that can provide positive impact. And finally, hold your own business and others to a higher social standard. So again, whether that's B Corp certification or whether that's just pushing yourself to be better, make sure you hold your own businesses to a higher standard and vote with your dollars for other businesses that are doing things that you agree with and support, rather than just going with what's always happened in the past. So thanks a lot. I'm looking forward to taking some questions.
Awesome. So we're going to take a few questions for Ray. We only have one working mic, so I'm going to be kind of the runner back and forth with the mic so that everyone can hear the question. And just a reminder that we will give you a chance to talk to your neighbors afterwards. So if everyone could just respect the speaker and listen while they're speaking, that would be great. There's one seat up here, maybe one here. So if you want to come have a seat, you're more than welcome. Questions for Ray?
I can jump.
Okay.
Do you guys have interoperability between like QOC and like TELUS Global Health and My Health? Like one of the biggest problems in healthcare is that the EMRs don't talk to each other. And so if you're creating another form of silos, that's going to be causing more problems later on. So I was just wondering if you guys are interoperable.
Yeah, absolutely. That's one of the main value. It's probably the least sexy feature of our platform, but the one that's actually the most critical. What we don't want to do at QOC is create a new data silo that doesn't interact, it doesn't support the overall healthcare system. So we use HL7 integrations to be able to facilitate integrations, and we can do that with about the top 35 to 40 EMRs out there and HIS systems, depending on whether you're north or south of the border. So we use a variety of integration partners, or we can do those integrations in-house as well.
So we're all on board with health transformation agenda, that's why we're all here. But you also mentioned that we're kind of running out of money in the healthcare system. So how to reconcile this, transform, spend more money? Well, we're running out of money.
Certainly, I mean, if I had the answer to that, I probably would have. I think we don't. That's probably not a good state of affairs. But one thing really is, again, keep pushing healthcare into the communities is one of the most cost-effective ways to move the healthcare system forward. So I'm not sure what the exact statistic is, but it's been proven in like numerous pieces of literature that prevention is a much better form than treatment. The system as it's been set up has really been focused on treating things after the fact versus preventing them beforehand. So that's step one. The second one is really around reducing the reliance on transaction-based payments. So a lot of our healthcare system is based on transactions. Every time you go into the doctor, they can build a system for a certain amount of money. And that really incentivizes more and more transactions, which is again then fueling the problem. So as we can move towards more value-based payments as they are in the US, certainly that's another way. And then again, the third way is to embrace some new players in the healthcare system and really allow that innovation to take hold in the healthcare system rather than being scared of it and saying, well, that's not publicly funded.
Thank you so much, Ray. I'm gonna grab this.